Hi, my name's Patrice. The reason for this video is to give you a little bit of information about the situation that I went through for breast cancer and diagnosis. I hope that you find this information informative and enlightening for those of you who are going through this early diagnosis and may not know exactly what you're in for. First things first, I discovered the cancer myself. I was seeing a breast cancer specialist for 12 and a half years. Every 6 months, I was getting an ultrasound and a mammography, and during that time, I also had to have aspirations done because I was fibrocystic and was told that I had very dense breast tissue. So because of that, I had pain all the time and very lumpy all the time. That's what the fluidy cysts would feel like, which would make it hard also for anyone to discover if there was something else going on. Hence the reason why every 6 months I was getting an ultrasound and a mammography, I thought. The reason why this is important is because I feel, based on knowing that I had breast tissue that was so dense that it was hard to see anything on a mammography, therefore it was hard to notice anything on an ultrasound as well. When I was diagnosed with my breast cancer, which was back in March of 2011, I had felt something on the left-hand side of the left breast, right in where the underwire of the bra would be, which I'm finding out that a lot of girls usually find that on that side. When I went to the doctor, it was only 4 months prior that I had a mammo and an ultrasound. So it was the day before I went to see him, I had another mammo and ultrasound. And when I went to see my doctor, he told me I was just fine and that it was the same kind of things. He aspirated something on the right breast this time, and that the left breast felt really good. I told him something doesn't feel right. Plus, I was getting sick. I had a viral infection and a bacterial infection within 2 weeks of each other, and I was never sick like that. So I knew that my immune system was being compromised, and I couldn't figure out what was going on. So when I told him, it felt like the tip of a pencil eraser. That's all it felt like. He says, well, I'll do another aspiration on that. So he did. And obviously nothing came out. The next thing I know, I was sent for an MRI with the dye, with the contrast. And I was told that I had 4 tumors in my left breast. 2 were cancerous. 1 was benign. And the other one was too early to tell the difference, whether it was benign or cancerous, which I didn't quite understand that. So after that diagnosis, and mind you, the 2 tumors were 2.2 and 2.6. At this point, I'm like, what was he feeling for 12 years? What were they seeing on a mammo and ultrasound? If that were the case, and I had such dense breasts, why wasn't I sent for an MRI with the dye prior? By the time I had my surgery, I was already diagnosed at a stage 2A. Thankfully, it wasn't in the lymph nodes. But I have triple negative breast cancer. And those of you who know about triple negative breast cancer, it's not something that you really want to have if there's any type of breast cancer or good breast cancer to get. You know, usually they say that's not one of them because there's no reason, number one. There's no targeted treatment, number 2. And they give you chemotherapy hoping that that will take care of the situation. And after the chemo's done, there's nothing else they can give us. So in a way, I felt, and I'm not speaking for everybody else, I'm just talking about how I feel about this. I felt like a sitting duck. So I had my surgery. Mind you, well, before the surgery, what they did was they gave me another ultrasound and they ordered a core needle biopsy. Now, my question was, why, and you're so crazed at that point that you don't pay attention. But now, dealing with it now and looking back, I'm like, Why would they send me for another ultrasound when they couldn't see anything on it before? Oh, they're going to go by measurements? I mean, there was no direct, no direction in here to figure out where they should be sticking this core needle, which a core needle biopsy is like the size of a straw with a really sharp point at the end, and they jab you inside of your breast. Now, it's okay if, they knew where they were looking, I guess, but the doctor that was at the radiology area was sticking clips in my breast without telling me why he was putting them in there. Apparently, he was sticking them in there to get into the general area, so this way people would know where the cancer was, but I can't tell you how many times he stuck me with a core needle biopsy and with the core needle. And the other thing that you should know about that, which they should make sure they tell you, is that there is a risk with a core needle biopsy. Fine needle biopsy, not as much, because it's a tiny, tiny little needle. But the core needle is an opening, and therefore it could spread the cancer cells. If I had known that, I would have refused it. Of course, I did a lot of the reading afterwards because I was scared and I couldn't think straight. But now when I would have never allowed it, number one. Number two, by the time he got done sticking me 6 times, I was purple and green on my left breast, and I really didn't need to go through all that pain when he couldn't find what he was looking for in the first place. So that was the other thing. Mind you, I changed doctors, thank goodness. And when I went to the second place and had all my films sent to the second place, which was a very good, I went to Sloan Kettering, a great hospital, and they said that even the films that they saw looked different, what they saw. So everybody sees something different. Do I think that everyone should get a second opinion? I did. If your doctor's a good doctor and you care for him and everything else, that's great. But you're talking about your health, and I think that everybody needs to get more than one opinion about what they're doing just to make sure. I mean, why not? It's your life we're talking about, right? So I was told, you can do a double lumpectomy, but really, after all this, there were 4 tumors, 2 weren't. Who knows if they would turn? I wasn't going to worry about it. So the consensus was, to take the breast tissue out of the left breast. But I was like, well, if you're going to do one, you're going to do both. And the reason I had for that was because if you couldn't determine what was in one, if there's something over here or anyplace else, how are we going to know? I was the one who found it. Nobody could see anything. Am I going to be sent for MRIs all the time? So I decided to get rid of all the breast tissue. I felt that that was the smartest thing for me. P.S. Not only did I have it in the left breast, but I had it in the right breast, and I had it under my right arm. So that wasn't determined until they removed all the breast tissue. Does this happen to everyone? I don't know. Can the cancer go away? I don't know. Meaning, you get the cancer removed in one, and then I had the chemotherapy, and maybe it would have dissolved this? I don't know. A lot of people get treatment before to shrink tumors. It's possible. Some people get chemotherapy after they have their mastectomy, and they get a reoccurrence. So, it can go either way. Everyone is different. They go by statistics. I went by what I felt in my gut. And I think that all of us have to do that. My reasoning for putting this up is to just make you well aware that if you are told that you have dense breasts and you're just having a mammography and then you have an ultrasound, I don't care what you have to do. And this is me just talking from experience. Ask for the MRI with the dye. That's your best bet. At least you'll get even more answers at that point. Try to clean up your diet. Everybody that I talk to who had breast cancer has a low vitamin D level. It's D3 is so important. Talk to your doctor. And when you get your blood work taken, get your D3 checked. It's very important. It's just what I want to do for everybody else. And I hope that no one ever has to go through what I went through. And I wish you all the best. God bless you. And if I have any more information, I will be sure to post it and put it on here. God bless you. I love you, and have a great holiday.